Good afternoon. This is Dr. Kaminsky at the Walla Walla County Department of Community Health. And there was no Board of Health meeting today. And so I wanted to just do a brief update for our community. This is the heat map that we have been showing the Board of Health. And what it shows us is that once again, over 99% of the counties in the United States are at a high transmission rate. Good news, however, looking at the CDC data, the 7-day moving average case rates have declined almost 20% as of January 26. We are also seeing that hospitalizations are starting to decline, and this includes a decline in hospitalizations over all age groups. As of January 15, hospitalizations declined 17%. However, cases usually rise, followed by rising hospitalizations, but deaths are a lagging indicator. And we did see across the country an increase of 25% with regards to deaths. With regards to the Washington State case rate, the data is only up to date as of January 15. And looking at this, it looks like that the state case rate has not declined or plateaued, but there is indication that it is starting to plateau and is declining. This is the Washington State 7-day case rate curve, and you can see that it is starting to flatten out. The 14-day case rate curve doesn't show these short-term changes as easily. So this chart does show that the case rates are starting to decline. If you look at the eastern side versus the western side, as you recall, the western part of the state started with the Omicron wave, and then it came to eastern Washington a week or two later, and we are seeing that the case rate curves are starting to fall off on the west side of the state. We have not quite seen this on the east side of the state. Looking at Washington State hospitalizations, they are going up. There is some indication that they might be plateauing as well. Looking at the Walla Walla 7-day case rate, once again, this information is only up to date as of January 15, but looking at the state average, the eastern average and the western average, we were at that time behind all of those averages. Looking more closely at the 7 versus 14-day case rate curve, we did start to see that there was somewhat of a softening of the curve on that. Looking at our actual data, our case rate curve is 4118 as of today. This is the most up-to-date information we have. And over the past 3 days, these numbers have hovered in this range. So potentially we are at the peak of our cases, but it will take more time to fully ferret that out. This is data as of January 27. As you may recall, King County, Snohomish, some of these other counties had high case rates. Walla Walla was somewhere in the 20 range out of 39 counties. Our county is now 4th out of 20 as of January 27. Hopefully we're going to start to plateau and start to decline, not only in Walla Walla County, but throughout the state. The hospital situation has not really changed. Staffing continues to be an issue, but hospitalizations are not like they were in the past. They've hovered around 20 patients on the census per day or less. And we did change our graphic here to show the benefit of getting your vaccinations up to date. And from this chart, you can see that the majority of the admissions are either unvaccinated individuals or individuals who haven't gotten their booster. So we encourage our community to get vaccinated and to get boosters. With regards to our vaccination efforts, last week in Walla Walla, we had 6 clinics. We gave 245 total doses. Most of these are booster doses, and we're still seeing a small number of people who are initiating their vaccine series. Testing at Southgate did decrease a little bit from last week, from the prior week. We're we're averaging about 175 per day, and I think we peaked at around 225 per day average. There's a lot of information out there to show the benefit of getting vaccinated and getting boosters. This first part of the slide here shows that in the boosted population and vaccinated population, that just the chance of getting COVID is lower. And this chart here shows that if you're vaccinated and boosted, your risk of hospitalization and death is much lower. So we're hopefully at this, nearing the peak of this Omicron wave. Let's continue to work together, encourage family and friends to get vaccinations and boosters, and we will see you in a week at the Board of Health call, and depending on the situation, we might do an update towards the end of the week. So stay safe. Take care. Bye-bye.